Alrighty, so today I am going to be doing a intramuscular injection, and I am going to be doing the Z-track method. So the first thing I'm going to do is carry out my standard steps, which I'm going to introduce myself. I'm going to knock first. I'm going to introduce myself. I'm going to scan the patient's bracelet to confirm the name and date of birth. And once I know that this is the correct person, I'm going to check the order. I want to make sure that the order is correct. And then I'm going to gather my supplies, which I have right here. Okay, and then of course I'm going to calculate my dose, which I have done. And then the next thing I'm going to do is perform hand hygiene, wash my hands. And then the next thing I'm going to do is I'm going to go ahead and draw up the correct dose. So first I am going to wipe off my vial with alcohol. Okay, I'm going to let that dry. All right. And then the next thing, once that dries, the next thing I'm going to do is go ahead and draw up my my medication. So what I'm going to do is I'm going to insert air into the vial. Okay. All right. The same amount of medication that I need is the same amount of air I'm going to input in the vial. So I'm going to go ahead and I'm going to input that. Okay. Then I'm going to draw up how much I need. All right, I have the correct amount of what I need. Okay, and then I'm gonna go ahead and put my cap back just like that. Okay, and then of course I am going to change the needle. All right, so I'm gonna take that out and change my needle right here. All right. And of course, I'm going to make sure that my patient doesn't have any allergies or anything like that. And of course, I'm going to do my 3 label checks, of course, and also make sure that I'm following the rights of medication admission. Sorry. So at any rate, so after that, I'm going to go ahead and don my gloves. Okay. So I'm going to go ahead and put on my gloves. Okay. All right. And this particular medication I'm going to put in the deltoid. All right. So this is my pretend person's like upper arm and deltoid area. Okay. So what I'm going to do is the first thing I'm going to do is take my non-dominant hand. I'm going to retract the skin. Okay. Then of course I'm going to use my alcohol and I'm going to cleanse the area. And of course the area is going to be clean from inner and work my way out. Okay. All right. Now, once I let it dry, I'm going to go ahead and insert my needle. Okay. Okay. I'm going to insert my needle at a 90-degree angle. Okay. All right. So all right. So my hand is still retracting the skin. So before I insert the medication, I am going to aspirate and make sure that no blood comes out. Okay, I see no blood comes out. That means I'm good to go. All right, so I'm going to go ahead and inject the medication. Okay, inject the medication. And then I'm going to wait 10 seconds. Okay, and I'm going to withdraw the needle. It's okay, so once I wait my 10 seconds, I'm going to withdraw the needle and remove my hand at the same time. All right, and then once I do that, I'm going to throw this in a sharps container. And then I'm going to gently wipe the little injection area with alcohol, of course. Okay. And then what I'm going to do is I'm going to go ahead and document that I gave this medication. And that is it.